Hello everyone. So today we are going to start with another topic, which is depression and schizophrenia. Both your depression and schizophrenia, they affect your mental health, and they are opposite to one another. Okay. So let's see what depression is. So depression is a state of low mood and aversion to activity that can affect a person's thoughts, behavior, feeling, and sense of well-being. So any person who is depressed is going to have a very low mood. Okay. And aversion to activity, meaning like he will not be having any feeling to do anything, and this will also affect his thoughts and behavior, and mostly it affects your thoughts in a negative manner. Okay, where a person becomes or starts thinking only negatively about one another or about himself, his feelings, as well as his sense of well-being, so they all go into your negative mood. So depression is one of your most common type of disorder, which affects your mood and your emotion. That is, your depression is most common of your affective disorder. So any disorder affecting your mood and your emotion. So it is also one of your major causes of disability and premature death. So a person who is depressed has a tendency to commit suicide. So apart from a tendency to commit suicide, depressed individuals are more likely to die from other causes also, such as your heart disease and your cancer as well. So what are your causes of depression? One of your cause of your depression is family history. So if you have a family history or family member who has depression, then uh, then a person to develop depression is increased. So in case of depression, there is deficiency of chemicals in your brain, and due to this deficiency it leads to your depression. So when we talk about certain chemicals, it generally means your neurotransmitters. Okay, majorly it is your neurotransmitters in your brain. Second, family history is there. Major life changes, all your life changes which is negative in nature, can lead to depression, such as loss of your loved ones, loss of your job, right, can lead to depression. A stressful event, any event that causes stress, can also lead to depression. Along with that, major illness, okay, illness which is very difficult to treat, illness such as your heart attack, hyperthyroidism, stroke, cancer, which lasts for a very long duration of time, will also trigger depression in many patients. Certain use of medications or combination of medications. Certain medications may cause side effects which may be very much like any symptoms of depression. Use of alcohol or drugs can also lead to depression. Okay, and lastly, depression can occur for no apparent reason at all as well. So there are two types of symptoms that you see in case of depression, which first one is emotional and as well as a biological symptom. So in case of emotional symptoms, okay, your emotions, how it changes. So you have your low mood, so all your negative thoughts about yourself, misery, apathy, feeling bad, and thinking negative, that is your pessimism, it all comes into low self-esteem, where you have a very low self-esteem of yourself, feeling of guilt, not worth of anything, inadequacy, right, ugliness, not thinking that you are good, indecisiveness, loss of motivation, where you cannot decide anything, where you are not motivated to do anything, anhedonia, where you do not have any sense of pleasure, okay, loss of reward. So these are all your emotional symptoms. So biological symptoms is retardation of thoughts, okay, cognitive functioning, that is, okay, as well as of your action, There's loss of libido, sleep of disturbance, and loss of appetite are some of your biological symptoms. Theories of depression. Okay. So there are different theories which has been postulated to explain your cause of your depression, and one of your theories of your depression is your monoamine theory. So this monoamine theory is your first major hypothesis in relationship to explain your depression. So according to this theory, your main symptoms, okay, that you see in case of your symptoms that you see in case of depression arises because of your deficiency of noradrenaline, 5-HT, which is your serotonin, and your dopamine. Okay, according to this theory, your symptoms of your depression that you see in a patient is there because of deficiency of noradrenaline, serotonin, and dopamine. All these three things. Okay, all these three, noradrenaline, serotonin, and dopamine, they are basically your, they are neurotransmitters. Okay, they are neurotransmitters. Okay, and so there's decrease in your noradrenaline, 5-HT, which is your serotonin, as well as your dopamine. So this theory came into being or was postulated after from your evidences that came from your clinical observation. Okay, after treating a patient with drugs and observing them, okay, these theories came into being. So according to this theory, okay, so first we'll talk about one drug, risarpine. Okay, risarpine is an anti-hypertensive drug, okay, which is used to treat your hypertension, and whenever this drug is used, it causes depletion of your stores of your noradrenaline, stores of your serotonin, as well as your stores of your dopamine. Days whenever a person is treated with risarpine to treat hypertension, and this risarpine normally leads to depletion of noradrenaline, serotonin, and dopamine. It was seen that the patient started to develop syndromes which resembled that of your depression. So they started to become depressed because the use of these drugs led to depletion of your noradrenaline, serotonin, and your dopamine. And any person or any body who are using drugs which blocked your synthesis of your serotonin, as well as blocked your synthesis of your noradrenaline, it was seen that in those patients your mood was affected. They had a very low mood, and along with that, using these drugs which blocked your synthesis of your 5-HT and your noradrenaline also reversed your action of your antidepressant drugs. Okay, so reversed your action of your antidepressant drugs. Okay, so with this the monoamine theory was developed. Along with that, you see, if you are blocking your reuptake of your serotonin and your noradrenaline, was effective as an antidepressant, because more amount of serotonin and noradrenaline will be available for your action on their own receptor. Okay. Next is your neuroendocrine mechanism. So when we talk about your neuroendocrine mechanism, you have your hypothalamus, you have your pituitary gland. Okay, whenever a person is under stress, there's going to be release of corticotropin releasing hormone. Okay, so hypothalamus interacts with your pituitary gland by hypothalamic neuron. Okay, and this neuron liberates noradrenaline and 5-HT, and then causes your pituitary and regulates your pituitary gland. Along with that, release of your corticotropin releasing hormone also stimulates your CRH. Okay, corticotropin releasing hormones also stimulate your pituitary gland to release your ACTH, which is your adrenocorticotropic hormone. So increased secretion or increased release of your ACTH leads to release of your cortisol. Correct. Hypothalamus is interacting with your PG, which is your pituitary gland. So hypothalamus has a one neuron which goes and it ends in your pituitary gland, and it is regulated by noradrenaline and serotonin. Second, whenever a person is under stress, there is more release of corticotropin releasing hormones. These hormones, they go and they stimulate your pituitary gland to release your adrenocorticotropic hormone. So activation of adrenocorticotropic hormone will increase your release of cortisol as well. So whenever there is increased release of cortisol, it means there is increased amount of plasma cortisol. There is high amount of level of your cortisol in your blood as well. And it is always seen that patients suffering from depression, there is high amount of cortisol present in your blood. Okay, so any person who is suffering from your depression, there is high amount of cortisol present in your blood. Okay, as well as apart from that, as well as it has been seen that your corticotropin releasing hormone is widely distributed in your brain. Okay, it is widely distributed in your brain, and this hormone, it affects your behavior of a person. Okay, it affects your behavior of a person, and these behaviors being affected by your corticotropin releasing hormone, it tends to resemble in a negative way, that is to those behavior that you see in a depressed patient. An animal experiment was also done. Okay, your animal was there, an experiment was done in which your brain of your animal, your corticotropin releasing hormone was injected. Okay, after injecting your corticotropin releasing hormone in your brain of your animal, your behavior of your animal changed. Okay, there was a change in your behavior of your animal, and your behavior that your animal showed was like that of your depressed human. So it mimicked some aspect of depression that occurs in your human as well. Furthermore, your level of corticotropin releasing hormone is in high amount whenever a person is under depression, and it is seen in high amount in your brain and cerebrospinal fluid. So with all these findings, your neuroendocrine mechanism was postulated. Okay. Plasma cortisol, depressed. Okay, I said raised CRH level are associated with stress, and in many cases depression is perceived by periods of chronic stress. Correct. So, and now you have another, which is your tropic effects and your neuroplasticity. So when we talk about your tropic effects and your neuroplasticity, it has to deal with your BDNF, which is your brain derived neurotropic factor. Okay, so one of your main function of your BDNF is, okay, your BDNF generally tends to promote your functioning as well as your proper growth of your serotonin neurons. Okay, so BDNF helps in normal functioning as well as your growth of your serotonin neurons in your adult. Okay, so in case of your tropic effect and your neuroplasty, it has been seen that in case of your depressed person, there is less level of BDNF. Okay, so there is less level of BDNF, or there is malfunctioning in your receptor where your BDNF works or acts upon, which is your TRK beta receptor. Okay, BDNF shows its action by acting on its receptor, which is TRK beta. So in case of a depressed person, there is either low level of BDNF or your receptor in which it acts is malfunctioning, is not functioning properly. So this is it. Along with that, it has been seen that whenever a person is treated with antidepressant, okay, whenever a person has been treated with antidepressant, it tends to increase your amount of BDNF. It increases your level of BDNF in a person's brain. Okay, so this is in regards to your BDNF. Next is, in case of your depressed person, there is always less amount of glutamate. Okay, cortical levels of your glutamate has increased. Okay, apart from that, okay, if you see your last point, in case of your major depression, is also associated with, there is neuronal loss of you in your hippocampus and your prefrontal cortex. Okay, there is neuronal damage, there is damage taking place in your neurons. So whenever you take your antidepressant therapies, it has been seen that it is going to reverse this loss by stimulating your angiogenesis or your neurogenesis in this case. Okay, so this diagram explains it all. So first we'll talk about stress. Okay, over here there was stress. Okay, so this is your stress. So whenever a person is under stress, there's your release of your corticotropin releasing factor, which goes and acts on your pituitary gland and causes release of your adrenocorticotropic hormone, which increases your cortisol level. The main function of your cortisol is it goes and it activates your detrimental gene transcription. So detrimental gene transcription will lead to increased neuronal apoptosis. So there will be damage occurring. Okay, so you get your depressed symptom. Side by side, what happens is it is going to inhibit your neurogenesis, which is actually good for your body. It is stopping neurogenesis, but it is activating your neural apoptosis. So you have your depression. Second is glutamate, CA. Okay, so over here there was glutamate. You were stress is increasing your amount of glutamate. It acts on your NMDA receptor. After activation of your NMDA receptor, what it is do? It goes and it causes neural apoptosis. So due to this apoptosis occurring, you see a depressed symptoms. So in case of your depression, okay, there is less level of noradrenaline, 5-HT and BDNF. Okay, in case of there is less amount of noradrenaline, 5-HT, which is your serotonin, and BDNF. So normally noradrenaline would act on its receptor, alpha-2 receptor. Your serotonin will act on its 5-HT1A receptor, and your BDNF will act on its TRK beta receptor. So activation of this receptor normally inhibits your detrimental gene transcription. Okay, so it is inhibiting this action, whereas it is activating your beneficial gene, which is good for your body. So activation of your beneficial gene will lead to inhibition of your neural apoptosis. It will activate your neurogenesis, so thereby you do not get your depressive symptoms. But in case of depression, what is happening is you have less amount of all these three substances. So since you have less amount of all these three substances, activation of these receptors does not take place. Because activation of these receptors does not take place, your beneficial gene functioning is not occurring. So you have your functioning of your detrimental gene functioning takes place. So there is neural apoptosis, and then you get your depressive symptoms. Okay. Next we come to your schizophrenia. So whenever we talk about schizophrenia, okay, see, schizo, it means split, phrenia, it means your brain. Okay, so schizophrenia is your scattered or fragmented pattern of thinking. So any person who is suffering from schizophrenia, okay, there is a division between what actually is real and what a person perceives to be real is completely different. Something else is happening around, but he believes something else to be real. So that is what schizophrenia really is. So he is far apart from your reality of things going around him. Near around 1% of your population is affected by schizophrenia. So schizophrenic person, there are different clinical features that they show. So these clinical features can be divided into positive symptoms, negative symptoms, and your cognitive symptoms. So first we'll talk about your positive symptoms. In case of positive symptoms, there is actually going to be net gain in your person. Whatever you see, there is going to be net gain. Okay, so first is your delusion. So delusion is when someone perceives something else happening around him. Okay, second is hallucinations, seeing and hearing something that is not there. Disorganized speech, where a person speaks out but it is all disorganized. Abnormal disorganized behavior, where his behavior is not organized at all. So for this you can see a person wearing a jacket in a very warm day, so that is your disorganized behavior. Catatonia, a person who keeps on sitting at one place, not moving at all. Okay, so this is your catatonia or your catatonic behavior. So these are all your positive symptoms. uh, Positive symptoms. Next is your negative symptoms. In case of negative symptoms, there is always going to be net loss, and it has mostly to do with your emotions. Okay, so sorry, I forgot to tell you. Positive symptoms is all psychotic symptoms that you see in your patient. Okay, so in this case, there is net gain. Second, we come to your negative symptoms. So these negative symptoms, there is your net loss, and it is all in relationship to your emotion. So there is your signs where you see a withdrawal from social contacts. Okay, loss of interest is there. There is your flattening effect. Okay, where you have your loss of interest from anyone. Anhedonia, which is your inability to feel pleasure. Okay, allogia, where you have your poverty of speech, your speech is not going to come properly. Avolition, which is totally your lack of motivation. Okay, these are all your negative symptoms. And in case of cognitive symptoms, you have your deficits in your cognitive function, that is in relation to your attention and your memory. So for any person to be diagnosed with uh, schizophrenia, he has to show two of the following symptoms. Okay, any two of the following symptoms, which is two of your following symptoms, this one, two from your positive and your negative symptoms. But out of your two symptoms that a person shows, one has to be either delusion, hallucination, and organized speech. Okay, for a person to be considered a schizophrenic patient, he has to show two symptoms, out of which delusion has to be there, or hallucination has to be there, or disorganized speech has to be there. Out of these three, one has to be there, and the second one may either be abnormal or disorganized behavior, or maybe catatonia, or withdrawal from any one of these. Okay, has to show two symptoms. Okay, out of those two symptoms, one symptoms has to be out of these three, and this symptoms should be ongoing for around 6 months. Okay, so now we come to your cause. Okay, what causes a person to be schizophrenic? Okay, we come to your cause. Okay, so according to this also you have different theories associated with it. So we will talk about your neuroanatomical and neurochemical basis of schizophrenia. Okay, so as I told you in your beginning, this is completely opposite to that of your depression. In case of depression, there was less amount of serotonin, less amount of noradrenaline, okay, as well as less amount of your dopamine. In case of serotonin, there is going to be high amount of dopamine. Okay, there is increased amount of dopamine, and dopamine is a major neurotransmitter which comes into play when we talk about your schizophrenia. So for that you have your dopamine theory. So as your theories for your depression were related to what you say, your clinical findings, your theories for your schizophrenia is also related to your clinical findings and clinical observation. So whenever a person was treated with amphetamine, okay, amphetamine is your drug. So amphetamine causes release of dopamine, okay. So whenever a person is treated with amphetamine, amphetamine causes release of dopamine, which means there is going to be increased amount of dopamine in the brain. Okay, so such patients show that, okay, you have a patient who is taking amphetamine. Amphetamine will cause you a release of dopamine. So those patients who are taking amphetamine, it was seen that they showed symptoms which were similar to schizophrenia. A person who did not at all had schizophrenia took amphetamine. Because of taking amphetamine, there was increased amount of dopamine, and then that person also showed the symptoms of schizophrenia. Okay, first. Second is a person who was taking levodopa. Okay, this drug is used for your treatment of your Parkinson's disease. So this drug also increases the amount of dopamine. So also in this case, it was seen that a person should had tendency of hallucinations occurring, as seen in case of your schizophrenia. Okay, and lastly is your dopamine, what you call it, antagonist, or drugs which block your dopamine storage. Okay, so they also affect, example, your resarpine, okay, which affects your dopamine storage. So in this case, what generally happen is, since they are affecting dopamine storage, it was causing huge amount of release of dopamine, due to which you showed your which huge amount of dopamine, okay. And when it was treated along with your amphetamine, due to your treatment with your resarpine, which depleted the amount of your dopamine, your schizophrenic symptoms were not seen. Okay, so this is what was in relation to your dopamine theory. Along with that, okay, so in case of schizophrenia, there is always increased amount of dopamine. Along with that, your brain of your schizophrenic patient was cut. Okay, in your post-mortem, your brain was cut, and it was seen, in comparison to your normal patient, it was seen that there is increased amount of dopamine receptors. Okay, there was increased amount of dopamine receptors in case of patients who are suffering from schizophrenia. Okay, so you can say, according to your dopamine theory, a patient suffering from schizophrenia has increased amount of dopamine. Second is your glutamate theory. In case of glutamate theory, first and foremost, it has been seen that your brains, okay, whenever you talk about your brains, okay, your brains of your schizophrenic patient was checked, there was always less amount of glutamate uptake transporter, which is your V glut1 is always less. And whenever your receptor of your glutamate, which is your NMDA receptor agonist, was used, it was seen that your positive, negative, as well as your cognitive symptoms were being produced. Okay, apart from that, I already told you your brains of your patient expressed glutamate or less amount of glutamate transporter. So with this we come to your glutamate theory. So according to this theory, in case of your schizophrenic, there is decreased amount of glutamate. So your postulation for your glutamate theory was developed. Lastly, okay, is this? Okay, there is one more theory which is your serotonin hypothesis, okay, or your serotonin theory. According to this theory, why this theory came into being was any patient who was using a drug, okay, which is your LSD. Okay, LSD is your serotonin agonist, which goes and acts on your serotonin receptor, okay, and activates your serotonin receptor. So any person who is taking LSD, which acts as a serotonin agonist, which means it goes and acts on your serotonin receptors and activates it. So such patients or such people, they showed symptoms as that of your schizophrenia. So along with this, the third theory is serotonin hypothesis. So according to which it states that there is high amount of serotonin in case of your schizophrenic patient. So first is your dopamine, increased amount of dopamine. Second is glutamate, which is there is decreased amount of glutamate, due to which you have your schizophrenia. And then lastly you have your serotonin hypothesis, according to which there is increased amount of serotonin, so because of which you see your which there is increased amount of serotonin, due to which you see a schizophrenia occurring. Okay, so anatomically speaking, okay, so for your dopamine there are 4 different pathways. Okay, one, I already told you, one of your major pathway is your major neurotransmitter is dopamine. In your brain there are 4 main pathways for your dopamine. Okay, so first is your mesolimbic pathway. So when we talk about your mesolimbic pathway, okay, so in case of your mesolimbic pathway, your neurons sends, okay, this is your VTA, which is your ventral tegmental area, and there is your nucleus accumbens. Okay, this pathway, there is a dopaminergic neuron starting from your VTA and ending in your NA, which is your nucleus accumbens. So this releases dopamine. So whenever there is deficient of your dopamine coming from your VTA to your nucleus accumbens, you get your positive symptoms of your schizophrenia. Again, I'll tell you, there are 4 different pathways. First, the pathway is pathway arising from your pathway arising from your VTA going to your nucleus accumbens. So there is release of your dopamine in your nucleus accumbens area. So whenever there is decrease in your dopaminergic release in this pathway, you get your positive symptoms. Okay, second pathway is your mesocortical pathway. So in this case, in case of mesocortical pathway, there is a connection from your VTA, that is your ventral tegmental area, and then it goes and it releases dopamine in different parts of your cortex. Okay, there is release of your dopamine in your cortex. So whenever there is decrease in your secretion of your dopamine or decreased secretion in case of your mesocortical pathway, okay, what you get is you get your negative symptoms of your schizophrenia. Okay, and lastly you have another pathway which is your tuberofundibular pathway. This pathway generally it has no functioning in case of schizophrenia. And lastly you have your neostrigal pathway. This pathway as well does not have any functionality in case of your schizophrenia. So your two pathways that is important is your mesocortical pathway, in which if there is decrease in your dopamine you get your negative symptoms, and second is your mesolimbic pathway. So decrease of dopamine in this pathway will give you your positive symptoms. Okay, so with this we complete your today's topic as well.